We will now do a demonstration for orders. We are going to start by doing an order set example. After working with orders for a while, you might develop some order favorites. After you've developed order favorites, you'll notice it will always default to favorites first, but you can choose to go to all sets. Each order set is broken down into tabs. You'll notice here that we've got laboratory orders at the top, and it shows you that 7 out of 20 are pre-selected. Each order set will have different pre-selected labs and orders. You can review them, remove those you don't want, and add those that you would like to see. I'm going to select a radiology order so that you can see one of these blue pencils turn red. If a pencil is blue, there's no extra information needed. If you see a red pencil on the side, that means there is additional information that you must input. For the first question, we are going to free text a response. If it is not a free text response, and you do not see any answers up top that it's prompting you to give, always push F9 for more options. I'm going to unclick an order here, for example. There were meds and fluids included on your order set. However, I'm going to show you how to put them in from the Meds and Fluids tab here on the side. It is important to note that the medications and the fluids are in different tabs up top. You must be clicked into the correct one to get the correct formulary. For example, if you're clicked into medications and you try to order a bolus of normal saline, it might tell the nurse to pull out multiple 10 milliliter saline pushes and to push all of those. They're not going to want to do that. So just make sure that you're correctly into the right tab for whichever medication or fluid you're going to order. To find a medication or fluid, it is a type ahead function. It will begin to narrow down until you find the one you are looking for. We are going to choose a pre-built string to fill in the information needed up top to order this medication. Something you should note. Every pharmacy has pre-built these strings to match medications that your facility will carry. So it's easier to choose one of these pre-selected strings, although it is possible to edit them if you wish to have a different dose. It is now time to submit the orders. You'll notice that the order status is green and it says new. That means we are not finished yet. You have to finish submitting these orders and typing in your personal signature password. I want to point out something on the medications here. You'll notice there is a start and a stop time under medications. So medications have an automatic timeout capability that is set up through the Pyxis. For the most part, it's set at 4 hours at each facility. This is to prevent patients who get admitted from having orders that can be pulled by nurses upstairs that were meant for the ER. Now, the only time this is ever really a problem, for example, would be when you have a septic patient who's a very hard stick. Maybe you only have one line and there are 3 antibiotics ordered for this patient. That last antibiotic might time out before the nurse is able to pull it. So the nurse will just come back to you and ask for you to reorder that medication because it has timed out. And when it times out, it auto-cancels. Other than that, it should be good. This is a safety feature. I'm going to show you how to DC an order. We're going to select an order and we're going to click DC and put in a reason. I'm now going to show you your My Tracker that was mentioned earlier in the video. This tracker is going to be a list of only the patients that you have personally signed up for. This is something you might use at the end of your shift to keep track of your charts and which ones you need to finish. The My Patient 1 line is the most commonly used. You will notice there are 3 charts in 3 different statuses. The first one is in a canceled status, so this just means the template was canceled. The second one is in a draft status, that means it's unsigned. This is showing you a chart that is still open. And the last one you can see, it is in a signed status, and it is also in an e-signed status. This shows you that a mid-level signed off on that chart, and then you as the physician have gone in and signed off your piece of the chart as well. E-signed is the final status for a chart. We're going to click on the draft status and take a look at that chart. Now let's say you're not finished charting. You can put this back into a quick save status if you need to get up. Again, this only places it in draft. We're now going to return to the main tracker. We're going to click on trackers and click at the tracker on the very top. That will always be the main tracker. This is the end of our overview. Hopefully this gives you enough insight for you to be able to recognize things when we start class for hands-on training. Thank you.